All right. Very good evening to everyone. I am Asmita, Center Head at Jamshedpur Management Association, and I welcome you all on behalf of Jamshedpur Management Association. Today, for our ELS session, that is Enriching Life series, the topic of today's evening is third wave of COVID-19 pandemic. Just when we thought it's over, we have some bad news again. So I would like to welcome our President, Mr. Chanakya Choudhary, to please set the context of today's evening.
Thanks, Asmita. Good evening, everyone. I hope I'm audible.
Yes, sir. Yes.
So I think I'll talk about two things. One is the session per se, which we have planned for today, and the second is the theme or the topic for the day. The first is the session. So I think through the AIMA management, we had a small discussion with regard to creating regional setups under the LMA. So, in the eastern region, there are about 6 to 8 local management associations. And what is it of interest, which is of common interest across the eastern region? And can we suggest themes and topics on which we could, share experiences or share our thought processes and stuff like that. So we volunteered from the Jamshedpur Management Association to organize this first session. And I'm hopeful that this is not the only one in a series, and we will have much more collaboration and working together in the eastern region of the LMAs under the AIMA banner. Coming to the theme or the topic for the day, I think as Asmita was mentioning that last couple of years we've all seen what we have gone through, all of us together, as individuals, as families, as corporates, as government, and while everything is being done to ensure that we beat the pandemic in some way, but every 6 to 8 months there is a new mutant and a new virus which comes in. Very recently we heard about Omicron, and does this in some way tell us that are we looking at a imminent third wave in the near future? And I also volunteered in the Eastern Region coordination group discussion, saying that our medical team at Tata Steel has done a lot, not only towards the setting up of infrastructures for treating patients, for testing, etc., but also worked on prediction models, worked on a lot of indicators to check what is that will lead us from here to the next wave, if so it comes. So I think from that perspective, looking at what we saw in wave 1 as the lockdown, the wave 2, which was a bit of partial lockdown, but we still saw lives getting impacted. So a combination of lives and livelihood, and where is it that we are leading? So hence, I hope all of you who have joined us today will see a lot of interest in what Dr. Rajan Chaudhary, our advisor at Tata Steel, has to share. And thank you very much once again for joining. Back to you, Asmita.
Thank you, sir. I now request Mr. Amitabh Bhattcharjee, our secretary at JMA, to please introduce our speaker of the evening.
Yeah, thanks, Asmita, and good evening, everyone. It's my privilege to introduce Dr. Rajan Chaudhary. Air Marshal Dr. Rajan Chaudhary, an alumnus of the Armed Forces Medical College, was commissioned into the Army Medical Corps on 27th February 1977. He holds surgery and has undergone super specialty training in gastrointestinal surgery from AIMS, New Delhi. Air Marshal Dr. Rajan Chaudhary is a gastrointestinal surgeon of national repute and a member of the large member of professional society. He has published more than 100 papers in national and international journals, has authored 2 books and contributed chapters in 7 books. He was a postgraduate examiner of several universities and is on the advisory board on the National Board of Examination and UPSC. For his distinguished service, Air Marshal Dr. Rajan Chaudhary was awarded the Vishisht Seva Medal in 2004 and Ati Vishisht Seva Medal in 2013. Air Marshal Dr. Rajan Chaudhary is retired, was Director General Medical Services Air prior to joining Tata Steel as General Manager Medical Services in July 2016. Presently, he holds the position of Advisor Medical Services, Tata Steel, post his superannuation as General Manager Medical Services on 31st August 2020. So with this brief profile, I welcome Dr. Rajan Chaudhary once again for this talk. Thank you. Over to you, Asmita.
Yeah, good evening. Thank you, Amitabh, for a generous introduction. And I thank JMA for inviting me to give this talk. Give me a minute so that I can get the slides up. Are my slides visible?
Yes, sir.
Thank you. Once again, good evening to everybody. I will take you through the journey of COVID to understand where we are stuck now. With an imminent third wave due to Omicron, things have changed and we have all come out of our comfort zones and we are looking at how do we face the third wave. Historically speaking, this is the pandemic which hit the world about 100 years back. This is the Spanish flu, lasting for approximately 2 years and had 3 major waves world over with huge number of deaths. But what we must remember, at that time, the medical science was also in its infancy. Come 2019, December, and that's the time the COVID-19 pandemic hit us. The worst affected countries are the Americas, the North American and the South American continents. The next is the Southeast Asia, and we belong to that part, and then Europe. If you see the other countries like Africa, Pacific, etc., are much lesser impacted. If you look at the waves, presently the world is going through the fourth wave. You know, when you see the world statistics all over, we are probably going through the fourth wave. But if you see the US and UK, who have had a large number of cases, they are going through what is the third wave. India has had 2 definite waves in August, September last year and April, May this year. Important to note, in spite of all this, the deaths in US and UK, and I come to that a little later, are lesser in the later part of this graph. Yeah, this is what I was trying to tell you, that towards later part of 2020 and 2021 now, when the vaccination started all over the world, and UK and US, we are well aware, were well ahead of the pack, the number of deaths were lower than the number of people impacted. A clear message that emerges for the vaccine doubters that vaccine does protect against serious illness and deaths. A few slides on our journey of Tata Steel in our medical response to the COVID-19 at Jamshedpur, as well as at our RM location hospital. In addition to that, we were also operating 3 other hospitals in Orissa, in Kalinganagar, Gopalpur, and another college that was converted into hospital near Kalinganagar. So what did we do? In the very first wave, we went about adding beds, both invasive and non-invasive ventilator beds and the COVID beds. You will all remember in the first wave, the diktat of the government was anybody positive has to be admitted. That's when a lot of bed space of the hospitals was used. The general public was disgruntled. If I'm asymptomatic, why do you keep me for 14 days? Well, things changed from this when the second wave hit us. Some of the earliest and positive things we did is, and because TMH is a large delivery hospital. We do about 5,500 to 6,000 deliveries a year. And therefore, when the COVID first wave struck us, we realized we will have suspect or positive fully pregnant ladies who will come in for delivery. We created a separate COVID facility for labor as well as for the operation theatre required for these cesareans. We also created facilities with the blood bank to harvest convalescent plasma during the first wave itself. What is important is What is important is plasma is no more indicated, but then in this whole pandemic, we have been moving from one treatment protocol to another as the knowledge has evolved. So I wanted you to see these bars just to understand how the philosophy of the state government, central government changed, and with that our preparations changed. In wave 1, at one time we were operating almost 1090 beds. In wave 2, maximum we did 595. But then all these were either critical bed or oxygen supported beds. And that is very important. The rest of the people could stay at home. So even though the number of patients in the second wave was much larger, we could make do with lesser number of beds. In addition to that, in the second wave, which was the Delta virus, the requirement of oxygen went up significantly. You must have read all over the press the oxygen shortages that were felt in Delhi, Mumbai, etc. But in this part of the country, we were lesser impacted thanks to the steel plants, and we were able to provide oxygen was never an issue in this part of the country. We augmented our infrastructure, and in addition to that, we augmented instruments and equipment. We also got, in addition to the large amount of purchases that we did, we also got aid from Tata Sons and Tata Trust, and also the state government in the form mainly of invasive and non-invasive ventilators. Of course, most of the syringe pumps, multi-parametric monitors, high flow nasal oxygen were purchased by Tata Steel. We also purchased a large number of consumables in the very first wave. Why I am telling you all this? When the pandemic hit, nobody in the world was prepared with the PPE kits. The PPE kits were literally non-existent. The type of kits required for COVID were not the same as required for HIV. And therefore, the demand for kits, gloves, and then later remdesivir injection skyrocketed. Our response was not restricted to Tata Steel at Jamshedpur only. In two states, Jharkhand and Odisha, we set up the yellow ones are the hospitals that were in Jharkhand, and the blue ones like Joda, Odisha, Kalinganagar, Angul, these were Gopalpur. These were the hospitals either aided by us or partially operated by us at various places. The number of the facilities were augmented as the wave after wave hit us in the form of provision of oxygen, provision of doctors, provision of equipment, provision of medicines, etc. We went on and on and on. One of the earliest things we realized somewhere in March, April of 2020, that testing labs were very limited in the whole of country. And we need to have our own RT-PCR lab. We required an ICMR and NABL accreditation to start a virology lab. We started this in the most difficult circumstances. The equipment had to be airlifted from various parts of the country, and we were able to successfully set up an RT-PCR lab in Jamshedpur Tata Main Hospital on 24th April 20. Using the expertise we had, we set up two more labs, one at Kalinganagar and one at Gopalpur, to do the RT-PCR testing. Also, we kept our flexibility to do antibody testing done about 2,94,000 tests, of which 1,56,000 is RT-PCR and 1,37,000 is RAT. You can see the graphs going up and down in the over the last 2 years, and this clearly shows that our testing really helped. So how did we use this testing? To optimally utilize testing for the patients and testing for the so-called workers. and making workplace safe. We started using rat antigen in the steel plant to pick up any early positive case. We had the pod system by which people could be isolated, so the continuity of business was not impacted. Parallelly, we did about 3 rounds of antibody tests. The green bars in the diagram show you the antibody tests. And this could give us what is the seropositivity of a given population and also help us in planning our strategy. These testing was not restricted again to Jamshedpur, but we did these testing, the multicolored bar at Angul in Odisha, Kalinganagar, West Bokaro, Jharia and Noamundi in Jharkhand and Joda again in Odisha. We did a large number of antibody tests in both these phases, in other places also, so we got a better picture in our prediction model. So how did this help us? We were able to use this data initially to find out the seropositivity and published one of the earliest international papers which went into WHO repository, and later to have our own prediction models. I will come to that a little later. We've all seen that India has been hit by 2 waves, the red line, and it is approximately 41 weeks. Today we are actually at 82 weeks and 41 weeks of each of them. The red one shows how fast the second wave went up. On the peak, we had 473 cases coming up in a week, and the blue lines show the first wave. If you also notice, the blue wave was much not so high and also broader in its span, while the second wave, which we all know due to Delta virus, had a very high infectivity rate. Till date, in Jamshedpur, we have treated about 7,100 positive cases, and we have had 1097 deaths, a percentage approximately of the overall positivity at 4.9. We lost 68% were patients who were above 60, and 51% of these patients who died had more than 2 comorbidities, and 28, 1/4 of the patients who died lived less than 48 hours in the hospital. What does this statistic show? Statistics, and this is still being supported, that if you are more than 60, if you have comorbid conditions, you have a higher risk of developing severe disease and fatality. So these are the people who need protection and who need to be looked after better. Also, if you have the disease, do not hide it. Come to the hospital early so that the treatment, whatever is available at a given time, can be instituted early. The treatment protocols that we followed and primarily were from the Ministry of Health and Family Welfare, ICMR, SECM, the Royal College of Obstetrics and Gynecologists. I did mention about our gynae initiative, World Health Organization, and peer review journals, etc. This was the earliest of our papers on antibody study and seropositivity that reached great heights. It showed that the antibodies that you develop because of infection or even because of vaccination tends to wane month after month, week after week. And therefore, it is important to monitor when should we give the booster dose, third dose, as and when. The ICMR is working on it. The central government is looking at a thing, but there is a strong case for giving the third and booster dose, especially the susceptible people. The COVID first and second waves taught us a lot of things, and these are some of the issues that I would like to share with you. We launched a lot of digital initiatives while the COVID waves were going on. And some of you are aware of Jamshedpur ecosystem, and the load and type of patients we get in Jamshedpur OPD and inpatient will realize it's difficult. So we started telephonic consultations, repeat medicines month on month for blood pressure, diabetes, heart. We started video consultations with super specialists. We started online slot booking for COVID testing, so there is no overcrowding. We use bots for COVID testing data upload into ICMR website. This is a tedious task and this was overcome. We started online booking for home delivery of medicines, and we started online status update of patients. I will come to this particular initiative a little more in detail. You will all agree with me, in a normal hospital when there is no COVID, if somebody kith and kin is admitted, the relatives come, they talk to the doctor, counseling takes place, they meet their patient in the evening hours and go back. Once COVID came, the hospital wards became a big no-no. The communication between the patient relatives, and the doctors came to a standstill. This created a lot of uncertainty and ambiguity on the nature of the virus, uncertainty on the progress of the disease, patients' management in isolation, so people were always skeptical, and patient could never enter the patient, the relatives could never enter the patient. There's a lot of anxiety in the community, particularly in the relatives. TMH does what is called a net promoter score. And during these months, if you see July, August, September, that's when the first wave hit us, our numbers were falling rapidly. We did a root cause analysis, and the primary reason was the inadequate communication with COVID positive patients. So we started a three-pronged strategy for effective communication. A telephonic call was sent to each relative, the registered telephone number, by one of our doctors once a day. May I request somebody who's got his mic on to mute it, otherwise there will be an echo. The call center was started and the data was uploaded. People had to ring up the call center, and from there the data or the patient status was sold. Here we move a step further. We started entering the patient data at least 3 times by the duty doctors, once in each shift and once by the specialists. Call center, always the telephones were busy, so we had our TMH Bishwas and app well conversant. You download the TMH Bishwas app, register your number, and thereafter you can have a look at your patient status any time of the day. This was a great initiative which helped the patient relatives calm down the nerves of the people. And with this, you can see the net promoter score jumping up, even went a little higher into 70s and high 70s. How was the system working? I won't. The doctor takes round, enters in the data, the hospital management system records it. The TMH Bishwas app, as I said earlier, was the app through which you get the information and you go through it and get the information. I will not take you through this in more detail. Some of you have already downloaded. If not, please do it. It helps. We come to vaccines, and when the second wave was going down, one of the things that was emerging was vaccination is the way forward. That is how we will control the pandemic. We were right from the beginning, from January 16, 2021, when the vaccination was started. Tata Main Hospital registered for that, and we started our vaccinations for the healthcare worker, then elderly and various groups time and time. Till date, we have given almost 4 lakh or 5 lakh vaccinations, out of which 1,60,000 vaccinations have been given in the 2 states of Jharkhand and Orissa to the community, where our CSR team is helping out and going into the villages and giving vaccination to these villagers. In addition, the Tata Steel environment is also giving vaccination to all its employees, their families, vendor employees. It helps. The more people you vaccinate, the safer you are. So just this slide to show you, this is a download from the main system. East Singhbhum, where Tata Steel has the major presentation, is ahead of all other districts of Jharkhand state itself, where 52.39% of the population has received first dose and 30 plus have received the second dose. This is the percentage of all population, not the eligible population. You see, India is a young country where almost 40 crore people belong to the age group of 18 and below, and therefore this gap will always be visible. And if you see the area of operation of Tata Steel in both Jharkhand and Orissa, you see our percentages in Orissa as well as in East Singhbhum are good. Ramgarh is following very closely at 46% first dose at least. When the second wave was dying down, one of the things that was in everybody's mind, and you will all agree, we were bashed and battered in the second wave. How do we prepare against a COVID third wave? We started going ahead with this right in June of 21. We thought we will require more beds, we will require more ventilator, we require more buildings, etc. And that is when we went ahead with the target of having 1,040 beds in Jamshedpur itself, out of which there will be the ventilator beds of 144 in number. We have set up 2 more buildings, KSMS and Graduate College, which if required, these are some of the pictures of KSMS, the wards where the COVID patients will be housed. We have also gone ahead with procurement of huge quantities of monitoring, treatment, equipment that will be required in case we have it. I've already told you about the hospital numbers. We didn't stop only at Jamshedpur. We went ahead and augmented our resources at all our locations, the 4 RM location hospitals at Jharia, West Bokaro, Joda and Noamundi, where we have oxygen generation plants, invasive ventilators and non-invasive ventilators, equipment, medicines. So they are already in their places to handle. In Kalinganagar, where we have a Tata Medica hospital, the number of beds have been augmented and more beds are being added even as I speak. We expect to reach around 350-400 beds with sufficient number of ventilator beds. Other places in Angul, in Odisha, also augmentation of resources and tying up with other people so that maximum people, if at all the third wave hits. These are some of the third wave preparation. This is the KSMS building. You see that blue structure. It is not the main building. It is a ramp made for patient safety. These buildings are originally not designed as hospitals. Similarly, you see the KSMS ward, the second picture, the third picture, how the wards are laid out. We have even put a CT scan machine in the KSMS complex to handle the COVID patients. And of course, oxygen generation, oxygen manifold plants have been done. Tata Main Hospital, taking the lead, went ahead with the research protocols and publications. I'm proud to say the team TMH has published almost 12 COVID-related papers in international journals. And today morning, I got the news, we have now 6 of our articles registered in WHO repository. And therefore, it shows the type of work, the statistics that we collected and published, which is recognized internationally. What was more important is there were a lot of prediction models coming up, and we too, Tata Steel has been working up with the Sutra team from IIT Kanpur on it. Meanwhile, based on our work on antibodies and the seropositivity in the community, we came up with our prediction model, and this was an international paper which has also been accepted. Important part is we said if there is no major mutation of the SARS-CoV-2 virus, then escape from immunity will be provided and previous infection and vaccination. What I mean to say is, this is the key word, if there's no major mutation, we don't see the third wave till March. Everything was going hunky-dory till November middle when Omicron virus came into existence from South Africa, and that's where the mutation had taken place. So question you will ask me and I'm answering upfront. Will there be a third wave? Yes, there will be a third wave. The question is how severe and how fatal it will be remains to be seen. The next slides we will show you how. Go back to the global data. The main virus, the purple bars are the Delta virus, which has impacted the world over. It is still the dominant
Dr.
virus.
Rajan, I don't think I see your presentation. Is it only with me or it's for others as well?
No, others gave me an okay, sir. So I don't know.
Oh, okay. Fine. So maybe something is wrong at my end. Doesn't matter. You carry on then if others are able to see. Asmita,
Yeah,
you're able
Amit,
to see?
can you confirm, please?
Yeah, we could able to see.
Okay,
It's
good,
visible
good,
at
good.
the same.
Carry,
It's visible,
carry
sir.
on, carry on, carry on.
Sir, thank you, sir. So the purple bars actually show the Delta virus dominance in the world till about mid-November. By mid-November, the Omicron virus was declared by WHO as a virus variant of concern, and slowly the numbers are changing in South Africa. And this is how this was the Delta virus. The blue shows North America, South America, the whole of Russia, part of Europe, India, Australia. They were all dominated by the West. But slowly this is changing. On November 26th, the WHO classification for Omicron came in. It is the variant of concern. We all know that it started from South Africa, the big blob, but it is spreading from country to country. What is more important, if you look at the right-hand side, South Africa, almost 80% of the infections are due to the Omicron virus, while UK, US still it is 0.1%. Ghana and Botswana are also increasing in number of Omicron virus. And this is how the blues have now changing to red. Red is the Omicron. The blue color was the Delta virus. So the change is taking place, and I think it will be the Omicron virus that will dominate in the days to come. And this is how the spread has taken place in less than 2 weeks all over the world. Even India today has about 30 odd cases of Omicron confirmed. You see, it's not easy to confirm Omicron. You have to do genomic study. Once a COVID positive case is picked up, you have to do genomic study, the facility for which is existent in very few places. And then it takes time to confirm. So even if I say 30 Omicron in India, there will be many more who are undergoing testing, and the numbers may be much higher. The variant of interest, this is the WHO classification, is increase in transmissibility or detrimental change in COVID-19 epidemiology. It has virulence, which has changed, or there is decreased effectiveness of public health systems. That's when you call it a variant of interest. But a level above that is a variant of concern. All of you will be interested now. How is Omicron different from Delta virus? It's early days, but some of the things that are confirmed. It is unknown whether the replacement of Delta by Omicron as predominant virus in South Africa, but I've already shown you it is shifting from Delta to Omicron in South Africa, Botswana, Ghana, and it will change in due time all over the world. Also, the transmissibility of virus, because the spike proteins of the virus have undergone mutation. So it has a capability to bypass the immune system all of us have developed, and therefore it has a higher transmissibility rate compared to even the Delta virus. Even that had a very high transmissibility. So we are looking at, if nothing less, minimum Delta virus transmissibility, which actually means one person will infect two infect 4, 5, 10, and the numbers, it goes up in geometric proportion. The next question is, if we are looking at large number of patients having Omicron virus and infected by that, how will the disease severity be? It is unclear at the moment if the infection from Omicron is associated with severe disease. Where does this come from? It comes from the very doctor who in South Africa picked up the first few Omicron virus. And she, in her statement to the WHO, has said, most of our patients had mild disease, were treated at home. There were no deaths in that subgroup. The message is, but still it is early days. Omicron, more transmissible, but unlikely to cause severe disease or cause death due to Omicron, as we saw in Delta. Delta was dangerous. It caused severe disease and caused deaths. Another important thing that is emerging is the symptoms. The symptom complex is changing from the sore throat cough that we are all used to and fever. Majority of the patients are coming with increased fatigability. The only complaint the patient has is, I'm feeling very tired for last 1 week, 7 days, 10 days. Needs to be tested. This is the way Omicron is presenting. Of course, there will be some cases with fever and pneumonias. It tends to still affect the lungs quite badly, and therefore pneumonias will be there. The issue the whole community and the world is looking at. So what's happened to the crores of vaccines that we have given to the community, 1 dose, 2 dose, and a lot of countries have already moved to the booster dose for complete population or to the high risk population. Currently, there is no hard data to say if the previous infection or immunization will protect us. But there is scientific evidence to say vaccination is anticipated to continue and offer protection against hospitalization as death. Mark my words. So what does the vaccine do, or the vaccine that we have already taken do? It will prevent, we may be becoming positive, we will have mild symptoms or no symptoms, stay at home and recover. The chances that vaccinated people will have very severe disease or death still remain low, even with the Omicron virus. Another new thing that has come in towards the second wave monoclonal antibodies were developed. And it became very famous when President Trump was the first person who received the monoclonal antibodies consisting of two antibodies given in early part of the disease. Again, the evidence is not clear and there are multiple antibodies that have developed. Will the antibodies protect against Omicron? Answer is not clear, but we wait and watch over the next week, 10 days or 2 weeks when this will also emerge. But it is safe to say they may lose some potency, but the monoclonal antibodies will have some role to play in the system. So what about our diagnostic system? We are used to RT-PCR, TrueNet testing and RAT testing. These are the three tests that are very prevalent all over the world. What is the impact of Omicron on these testing systems? Well, the answer is RAT is not impacted. It continues at the same level. That means the Omicron virus or Delta wave virus, same. RAT test positive means positive, negative, we may be missing out some cases. It is here the RT-PCR tests may start missing some. And so there is already a WHO guideline. One of the pathology companies was producing a kit that had three proteins that were being tested. The S, the E, and PH protein that was being tested. Later, as the pandemic went, the S protein testing was stopped by the various kits. That's okay. Now, the WHO has come up that if you do an RT-PCR and the S protein escapes phenomenon, that means this patient has possibly got Omicron virus. So what does it mean? In the RT-PCR testing, should we revert to that old kit which we were using? And if it is S negative, send the patient's sample for genomic testing. We are already working on it and see that it gives us an early warning if the S protein is negative. Escape phenomenon, they call it. It's the spike protein which has been mutated in the present virus. Yeah, again, we keep talking of vaccination, its impact, good or bad. I use this slide to say there are 6 lines. 3 of them are in the blue and green color, and 3 of them in the yellow, light brown, and maroon color. The yellow, brown color, maroon color are the unvaccinated population in US, and the data clearly shows how the unvaccinated are more impacted than the vaccinated. It's a clear graph. It doesn't require much of explanation, and it is done weekly by the US. The message again want to convey: vaccination helps. And this is the vaccination status of the world. India is somewhere very close. There's a red line to the world figure. We have 57% of first dose, 34% of both doses. And what I said earlier, about 40% of the population is below 18. So the eligible population is at 57. And overall population, if you see, 34% of the India population has had double vaccination. The best of the countries which have good vaccinations are UAE, Singapore, Cuba, Portugal. These are the smaller countries, but credit to Chile and China, who are having a large population, have still done a good vaccination. What about the booster vaccination? The question that is being debated again and again in the system. On November 22nd, the AIMA chief himself, there's no scientific evidence, however, said a committee has been set up to look into the requirement. The National Technical Advisory Group met and they came out, it may help in people with comorbidities. But then again, they immediately clarified third dose of vaccination for the adult population is still not recommended. They are debating. On 24th November, Dr. Soumya Swaminathan from the WHO, she said moderately and severely immunocompromised person should be offered additional dose of COVID-19 vaccine as a booster. However, on 4th December again, INSEGOV, this is the committee set up by the government, in the weekly bulletin came up with no recommendation or suggestion for booster dose. It's going through a ding-dong battle, a booster dose or no booster dose. But the world is moving towards booster dose. About 20-30 countries have started moving towards booster dose. And it's just a matter of time. I think we will also move towards the booster dose. The questions after the second wave were on pediatrics. How will the pediatric population behave? Early, there were rumors that pediatricians, or rather the children below the age of 18, will be more impacted. May I request, somebody's mic is on and it will disturb the others. May I request for muting that mic? So if you look at the graph below, the darker the blue, the higher the age. And therefore, number of COVID positive cases were lower in the pediatric age group. The children were equally exposed to the coronavirus in both the waves. They were positive, but their body was able to handle the infection. They were asymptomatic or mildly symptomatic, and with that, they recovered and they were never detected. But children were infected by the coronavirus, as were the adults. The population above 60 was the one that got impacted, both in terms of disease and mortality. And this slide clearly brings out that it is the 65 and above who's had a higher mortality compared to less than 5 years or 5 to 14 years. You see the two dark graphs are literally parallel to the ground. However, work on pediatric vaccination is going on. Our own government cleared the Zydus COVID vaccine. It's a 3-dose regime to be injected by auto-injectors, no injection required by air pressure. And then later, even the Covaxin is being tested for age group 2 to 18. Incidentally, the Zydus COVID Covaxin was for 12 to 17 years of age. Covaxin is coming up, but it is still awaiting the final approval of emergency use authorization from DGCI. So we hope one of the two will soon come in. So we will be able to immunize 40% of our population, that's children below 18 years, and also protect them. Why this is important? I'm not contradicting myself when I say earlier graphs I showed you, the children were infected, but they were able to handle the infection very well, and they did not have severe disease. Now I'm saying the pediatric age group people should be vaccinated. Why is it so? See, if we don't vaccinate them, we leave a large population in the country and the world who are not vaccinated. So they become the storehouse for the infection virus to stay and then pass on to the adults again. To kill the cycle of the virus spreading from one human to another, all of us need to be vaccinated to a level when we call it herd immunity. A question often asked, and some of the people who have traveled abroad, what about mixing of vaccine? Mixing Covishield with Covaxin, mixing the Moderna and other vaccines used abroad with our own Oxford AstraZeneca vaccine, etc. Well, the data is not clear about mixing, and it's unlikely to appear that if you mix vaccines, you'll do better. But yes, the booster dose will be required. So what is my message at this preliminary stage of the Omicron as it emerges? Early days for us, it's just about 2 weeks plus when Omicron has been becoming a virus of concern. We should continue to monitor the trends of the globe as well as in our own country. A lot of people are following. Vaccination has to be given top priority for all. Booster dose should come in and pediatric doses should come in. What we continue with is social distancing, masking, and hand hygiene. I've introduced a word, ventilation is becoming the new word, keyword in prevention of things. Avoid closed door rooms, meeting, avoid travel in close confines of cars and buses as much as possible. That means travel should be brought down. And also, if you do have a meeting, or if you do are meeting people, meet in the open where the air movement and ventilation is good, and therefore chances of infection remain low. We should continue with testing protocols for travelers. And today, the government is coming down heavier on air travelers, foreign travelers, and even domestic travelers on basic tests that need to be done. But it has its own logistic problem, and it's not easy to handle. I said already, we need to have pediatric and booster doses to further augment whatever we have gained so far. I thank you for your patient hearing. I'm open to your questions, if any.
Thank you very much, sir. We have a question in the chat box. So Mr. Sanjay asks if the booster dose should be considered at least for health professionals.
Yeah, it has not yet been cleared. The booster dose, as not only for health professionals, the aged people, the people with comorbidities like diabetes, blood pressure, asthma, it has not been cleared for any of them. So we are waiting eagerly, and there are discussions going on. And I think, this is my feeling, very soon we should be having booster dose, at least for the high risk population in the country.
Thank you, sir. The session is now open for question and answers. Participants can unmute themselves or post their questions in the chat box.
Yeah, Mr. Tushar.
Yeah, good evening, sir.
Good evening.
Sir, this is Tushar from Indian Steel and Wire Products Limited, which is a subsidiary of Tata Steel. Sir, I actually am suffering from adenocortical carcinoma. I think I've met you earlier as well. Since you have mentioned earlier in your slides that Omicron, symptoms like weakness and all these other things, symptoms are available. But in my case, as you know, I have to take hydrocortisone due to my, adrenal gland is non-functioning. So how do I determine that this virus has infected me or not? Is there any way? Because I get exhausted a lot by the end of the day due to my work, and I'm working as well. So, any recommendations or something?
No, Mr. Tushar, I do remember, and you see, you are one of those rare cases. You have a disease of adrenocortical glands, and therefore you require steroid supplementation as a routine. And I'm also aware when you take steroids for too long, you have this fatigability and other side effects of steroids. My suggestion and advice to you will be to follow COVID uh, uh, precautions that we keep talking about. Keep yourself safe. And if you feel any other symptoms other than fatigability, please go and get yourself tested. There's no harm.
Yeah, thank you, sir.
Good evening. This is Dr. Gunasekaran from Coimbatore. Can I have a question, please?
Good evening. Please carry on.
I have already taken 2 doses of Covishield. This third booster dose is the same Covishield which I can go and take just like that?
No, you can't take the third dose because it has not been cleared by the government. See, since you have taken doses, you know the procedure. The vaccination, the batch number has to be uploaded in the system. For you, the system will not open for the third dose. Some people I'm aware of have taken a vaccine on the quiet. Well, that's not the correct way to move ahead. You'll have to wait for the government clearance to take your third dose.
There was an announcement recently to go for booster dose for the people above 40.
No, not yet cleared. Not yet cleared.
Okay. So we'll wait for the formal announcement.
Yes. Till then, we take COVID appropriate precautions, Yeah.
Okay. Thank you. Very kind of you.
Thank you.
Any more questions from the participants? Sir, I don't see any questions coming up. So if there are any doubts or clarifications, you can reach me and I can take your questions to sir. So I would, yes, anybody speak? All right. I would now request Mr. Saigal from AIMA to please present vote of thanks.
Good evening, everyone. I hope I'm audible, ma'am.
Yes, sir.
On behalf of All India Management Association, I take this opportunity to thank Air Marshal Dr. Rajan Chaudhry, AVSM, VSM, Advisor Medical Services, former General Manager Medical Services, Tata Steel, for addressing the session today. Thank you so much, sir. We would also like to thank Mr. Chanakya Choudhary, President Jamshedpur Management Association, and Mr. Amitabh Bhattcharjee, Secretary Jamshedpur Management Association, for taking this initiative in the Eastern region. We look forward to the other regions also taking up some of these initiatives in the near future. Last but not the least, we would like to thank all the representatives of our local management associations and participants for joining in. Thank you all. Have a good evening ahead. Thank you. Over to Asmita.
Thank you so much, sir. I would like to thank all the participants and, of course, Dr. Rajan Chaudhary for conducting a very relevant session of today. And a feedback form has been posted in the chat box. Please fill in. Your feedback is really valuable to us. And for more upcoming JMA events, please follow us on social media. Thank you. Have a good evening.
Thank you.